Well, we found years ago that Prozac, or fluoxetine, its chemical name, is found in sewage in and around Ottawa and elsewhere.
Well, in our study, what we found is that by exposing generation zero, so the embryos, there is a low cortisol level, so the stress hormone, and also behavioral alteration. If I exposed zebrafish or embryos during early on in life for 6 days, the effects that I observed in their adulthood gets passed on to generations.
The stress hormone in a fish, a frog, a cat, and a dog, and a human are the identical molecule. It's called cortisol. And the stress response is also the same in animals. If you have a restraint stress in a fish, so put them in a net, cortisol goes up. If you grab your kid and shake them, it's a stress. Cortisol levels go up. It's exactly the same. Even better is the molecular machinery, the mechanisms in the cell that allow for this transfer of information from one generation to the next. And that molecular machinery in the cell is identical in all animals. Stress hormones are there to help you adapt. And when it's too much, you get into hyperstress and you get into trouble, you get a disease. And what's happening now in the scientific literature are studies showing that low stress hormone levels are equally bad. If you cannot respond to an adverse situation, you do not adapt and you do not do very well. So low stress hormone levels are definitely not good. Low stress hormone levels are found in PTSD patients, for example. Why is this important? Well, this shows that a common, helpful therapeutic agent, fluoxetine, has effects. It has benefits in the people that take it, but it can actually have negative effects, and that can be transferred to the next generation and beyond. So we don't know really what it means, but do you really want to be influencing your children negatively? This is the question. This is the question we have to ask ourselves and ask the physicians. We have to start looking into what this really means.